Welcome back, and we're going to look at diazepam, its uses, dosage, precautions, and side effects. So what is diazepam? It is a benzodiazepine and it's available under the brand names of Valium, Clozapam, and so many other brand names. Uses: it's used in the treatment of anxiety, alcohol withdrawal, preoperative sedation, muscle spasm, seizure disorder, and status epilepticus. Dosage. Now the dosage will be determined by the type of condition being treated. So the adult dose in anxiety, it's usually between 2 to 10 milligrams per oral every 6 to 12 hours. In alcohol withdrawal, the dosage is 10 milligrams per oral every 6 to 8 hours during the first 24 hours, and then it can be reduced to 5 milligrams per oral every 6 to 8 hours when needed. In preoperative sedation, the dose is usually 10 milligrams IM before surgery. In muscle spasm, the dosage is between 2 to 10 milligrams per oral every 6 to 8 hours when needed. In seizure disorder, the dosage is between 2 to 10 milligrams per oral every 6 to 12 hours, and it's used as an adjunct. In status epilepticus, the dosage is between 5 to 10 milligrams IV or IM every 5 to 10 minutes and should not exceed 30 milligrams. Contraindications: diazepam should not be given to patients with documented hypersensitivity to it, patients with acute alcohol intoxication, myasthenia gravis, severe respiratory depression. So it should not be given in IV form in patients with shock, coma, or patients who recently received other respiratory depressants. Should not be given to patients with acute narrow angle glaucoma and open angle glaucoma. Should not be given to children below 6 months or patients with sleep apnea. Also, let's look at cautions. Now, caution should be used in patients with COPD, with sleep apnea, with renal or hepatic disease, patients with open angle glaucoma, patients with depression, suicide ideation, impaired gag reflex, patients with a history of drug abuse, patients who are obese because it may lead to prolonged action when discontinued. So also use caution in patients with a history of drug abuse, as I've said earlier, and also patients with acute alcoholism. So it's also important to note that should avoid using diazepam, avoid or minimize using it together with other CNS depressants and other substances associated with abuse, misuse, and addiction, for example, opioid analgesics and stimulants. Side effects: most common side effects include ataxia, euphoria, somnolence, rash, diarrhea, hypotension, fatigue, muscle weakness, respiratory depression, urinary retention, depression, incontinence, blood vision, dysarthria, headache, skin rash, changes in salivation, neutropenia, jaundice, and so many other side effects. So if you experience any of these or any other side effects, let your healthcare provider know immediately. So that's it for this video. Thank you so much for watching.